Is shock loss normal after an FUE hair transplant? If you're considering or have just had an FUE hair transplant, you might be wondering about the shedding you see afterward. The good news is that shock loss is a common part of the healing process. It happens because the scalp and hair follicles undergo trauma during the procedure, which can cause both transplanted and existing hairs to shed temporarily. This shedding usually starts within 1 to 3 weeks after surgery and can last up to about 3 months. The reason for this is that the hair follicles enter a resting phase, known as telogen effluvium, prematurely due to the surgical stress. This means hairs that were growing may fall out, including some in the donor area where follicles were taken. Despite this shedding, the follicles are still alive and healthy. They are simply in a resting state, and hair growth typically resumes within a few months. Many patients notice new hair starting to grow back around the 3 to 4 month mark after the procedure. The extent of shock loss can vary depending on several factors, including the skill of the surgeon, how many grafts were transplanted, and the condition of the scalp before surgery. FUE, or follicular unit extraction, is considered a minimally invasive technique. It uses tiny punch tools to remove individual hair follicles, which helps reduce trauma compared to older methods like strip harvesting. Because of this, shock loss tends to be less severe with FUE, but it can still happen. It is important to understand that shock loss is usually temporary. Permanent loss of hair due to shock is rare and often linked to over-harvesting or surgical errors. If you experience shedding after your transplant, know that it is a normal part of the process. It does not mean the procedure failed. Instead, it indicates that your scalp is healing and your hair follicles are preparing to grow new hair. Patients should stay in close contact with their surgeon to monitor progress and get reassurance throughout the recovery. Remember, individual experiences can vary, so personalized advice from a qualified specialist is always best.